Hi there, my name is Dr. Janelle Carreras-Montgomery, and I'm one of the 4 plastic surgeons here at Ocala Plastic Surgery. Today, I wanted to talk about a topic that seems simple, but truly most patients, when they come in, have a lot of questions, and that's silicone breast implants. Again, seems simple enough. Somebody wants a breast augmentation. They think they know they want silicone implants. They come in, sure, let's do this. Well, there's actually a lot more to it. I'm going to start off with a term that is thrown around in a lot of social media outlets and just in general, and that's a gummy implant. So now we're at a 5th generation silicone implant. So obviously that means there have been 5 different versions of silicone implants. And today's implants, again, the 5th generation implants, are gummy implants. The question is, how gummy are these implants? Originally, the term gummy implants was used outside of the medical community to refer to these anatomically shaped implants, because the anatomically shaped implants, you can see it's not a full circle. It's thinner at the top than it is at the bottom, which gives it a teardrop shape when we hold it straight up. It was used to describe this implant because to keep this shape, the silicone within this implant has to be very gummy, meaning that the silicone molecules stick together so that they don't just fall into whatever shape put in different directions. So clearly, even if I turn it upside down, the shape changes somewhat, but it's still holding relatively that same teardrop shape, just upside down. So that's where this gummy term originated from. Now, most of the implant companies that are FDA approved in the United States have a degree of gumminess. Now, I'm using Allergan Naturel implants here as an example, and they have 3 different forms of gummy implants. You have gummy, gummier, and gummiest. What does that mean when we put them in our bodies? Mostly, again, it means how close those silicone molecules are sticking together. And you can kind of see, let's see if I can give you a better image of this. You can kind of see when I hold this implant up as it would lay in somebody's body when they're standing up, most of the gravity brings the silicone to the bottom. This is the gummy implant. Now this is their gummiest implant, and you can see how much rounder this upper pole is compared to this one when somebody's standing up. Again, what does that mean when we put them in our bodies? It really means that it holds a fuller shape up at the upper pole, which ultimately is a little bit more of an augmented look. And people who want a faker look might opt for this gummiest implant to keep a lot of that upper pole fullness. Things that alter that upper pole fullness in the body is whether we put the implant underneath the muscle, which you can imagine causes more pressure in that upper pole, which would flatten it out. And again, if you wanted to keep that upper pole, you would want something that would counteract the pressure of that muscle a lot more than this implant, which doesn't necessarily counteract it because it's not as gummy. And then of course, here I have 3 implants. This is kind of the middle of the road, which gives you a little bit more upper pole fullness, but still allows more of that teardrop shape. Teardrop. Let's go back to this one. These are all smooth implants. Some of you might have heard recently, it's another hot topic outside of even the medical community on social media, about a lymphoma that has been associated with silicone implants. This anatomically shaped implant is actually textured, and I probably can't see that, but if I bring it closer up to you, you can see it has a texture to it. So it actually looks very different than this smooth implant. This lymphoma, which has been associated with only textured implants, has been associated with only that. Not any of the smooth implants, but only the textured implants. And this is what, again, most people refer to as gummy implants. But this same silicone can be found in this same highly cohesive or gummiest implant. I hope I clarified a little bit of that. I might have even given you more questions, but if you have any other questions, leave a comment and also let us know if there's any other topics that you'd like me to go over. Thanks. See you soon.